Good afternoon. This is American Surgery Center. My name is Kemal Erkan. Our Bariatric Friday, every Friday we are with you with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
Very well, Kemal. Thank you for having me. It's always wonderful to be back on Bariatric Friday.
Thank you for being with us. Our other providers are also a part of the program, who are Dr. Galvin, Dr. Mike Peters, Dr. George Ibrahim, Dr. Rahul Singh, and Dr. Sachin Ved as a colorectal surgeon, and our dietitians, Amy Wilcoxon, Batright, and Frank Tacon, who are supporting our patients. This is an accredited program, and we do have our webinars twice a month. On a Tuesday night, we take a little bit different approach on Fridays and try to break the topics into smaller sessions, and then try to help our patients to follow the issues that they need to better understand from the bariatric surgery process. So this is one of our Bariatric Friday sessions. So today we are going to discuss smoking and alcohol for patients who are going through the bariatric surgery before and after. And well, I guess we don't need to really say that smoking and alcohol, well, especially smoking, is bad for you. Moderate drinking may be okay, but because our patients are going through a lot of trouble prior to the surgery, and after the surgery there are changes in their certain diet, then we do need to take them. We need to make certain changes, and I'm going to ask Dr. Irgau to help me better understand why we have to discuss smoking and drinking for our patient population.
Absolutely. This is a very important topic, Kemal. Alcohol after bariatric surgery. Can I drink alcohol? How much is allowed is a question that comes up very frequently. So let's talk about alcohol first. So an important thing to understand, obviously, is that after bariatric surgery, after weight loss surgery, there is a change in the anatomy of the digestive tract. And I'm talking chiefly about the most common procedures that we perform. One is the gastric sleeve or sleeve gastrectomy, and the other one is the gastric bypass. In both procedures, there are changes in the anatomy of the digestive tract. Clearly, there are differences between the two, but nevertheless, there are changes that will affect how our body processes alcohol after bariatric surgery. So if we look at a normal anatomy where a person has not had surgery, right? What happens when they drink alcohol? Well, they drink alcohol. A little bit of it may be absorbed in their mouth, but then it goes down the food pipe, it enters the stomach. The stomach is a very large container, so to speak, that will hold to the alcohol for a little bit, and slowly it will empty it through a little valve called the pylorus to go into the intestine. The vast majority of the alcohol will be absorbed in the intestine and then go into the bloodstream, right? So when a person has had too much drink and they've stopped by the police in the road and there is a DUI, they check alcohol level in the blood, right? That's because that's where the alcohol goes after it leaves the intestine. Okay.
Now, so sorry, because you explained it, your introduction, I immediately wanted to ask you, well, the two main surgery that we do, 75% almost is the gastric sleeve, and 20% of the surgery is the bypass. These two are very different in terms of how the stomach actually shapes. And this explanation kind of is different for the sleeve than the bypass. Would that make a difference for those two patient groups?
Absolutely. There is a big difference, in fact, Kemal. And interestingly, this difference will affect also our discussion on the smoking. But going back to the alcohol, essentially what happens is with the sleeve gastrectomy, where we have removed almost 80-85% of the stomach, the larger portion of the stomach, which is known as the greater curvature of the stomach, there is not really very much reservoir there. The alcohol will enter and it cannot sit there for very long. It will pass into the intestine fairly quickly. So that buffering function that the large stomach provided to a person who has not had surgery will not be there. Therefore, the alcohol will reach the intestine much more quickly. This is in the case of the gastric sleeve, right? The situation is even more drastic, much more drastic with gastric bypass, because now the stomach that receives the alcohol is as big as an egg. It's very, very small. After that, the alcohol will go directly into the intestine, because with gastric bypass, as you may recall, we divide the stomach to create a small stomach that we call pouch, and then we attach the intestine directly to the stomach. So after the alcohol leaves the little pouch, it enters the intestine, and then it's reabsorbed in the bloodstream very quickly. So what exactly happens then with gastric bypass? Well, a person who drinks alcohol after gastric bypass, they will get drunk much more quickly with much less alcohol, and they will stay drunk for much longer. The comparison that we very often make is that one drink before bariatric surgery equals to 3 to 4 drinks after bariatric surgery, right? So if a person has had a little bit of drink without bariatric surgery and they think, okay, I can drive, my alcohol level will be okay, I won't be caught. Well, a bariatric surgery patient will have a very high alcohol level, even with very small amount of alcohol, right? So the absorption of alcohol is much faster, right? And that person will have that high level of alcohol level in their blood for much longer after gastric bypass. So with gastric bypass, clearly there is a very, very different situation when it comes to the what happens to the person who drinks alcohol, right? Now, beyond this issue of having the alcohol reaching the bloodstream much more quickly, and the person having and feeling the effects of alcohol with much less alcohol after, particularly after gastric bypass, there are other things that have to be considered, right? Alcohol itself can damage the lining of the stomach. After gastric bypass, we have a much smaller stomach, and that lining is much more likely to be damaged, right? More importantly, also, when we do bariatric surgery, what are we trying to do? We're trying to get the person to lose weight. Well, what happens when we drink alcohol? We're taking free calories, right? There are other effects of alcohol that actually work against weight loss. Drinking alcohol actually increases one's appetite, right? And very often people will drink alcohol in mixed drinks as well. And very often they will add juice, they will add soda, right? And those are all calories. So a person who's trying to lose and drinks too much alcohol will actually defeat that purpose, right?
So, Dr. Real, let's talk about the actual social situation that patients in. So if this is after the surgery we are talking about for drinking, right?
Yeah.
So if I lost 75 pounds after the surgery, now I feel good, and I go to a party and just want to have a drink, and then because everyone else is having so many of them, how am I going to handle that?
Absolutely, absolutely. Clearly, I mean, alcohol in our lives is very important, whether it's, brunch and you're having a Bloody Mary, whether it's happy hour after work, whether it's wine with dinner, or other social situations. Well, absolutely, absolutely. Well, so how to handle that? That's important. First of all, I can tell you that to our patients, we tell them actually for the first 6 months, even a year, try to avoid drinking alcohol, right? Just stay away from it, right? So avoid situations in which you'll be forced to do that. But life goes on, okay? And afterwards, there will be situations like that. Now, as I mentioned, particularly a person who's had gastric bypass, they are likely to feel the effect of alcohol much more quickly, right, after they drink. So if they're going to spend an evening with friends, what I would suggest is, you know what, take a cocktail glass, fill it up with water, maybe a little bit of lime, and just drink with people, right? And after people have had 2 to 3 drinks, then maybe you should have your first drink, right? Because the effect on you is going to be so much quicker. So if you start with other people, you will be way ahead of them with that first drink while everybody else is sober around you, right? So that would be one way to to handle that situation.
My approach on the eating too much at these parties, where I ate like the egg whites before I go, so that I feel full. So it's almost like the same logic, right?
Absolutely. So clearly, alcohol is part of our life, right? In society. So if people choose to drink, obviously there is, we're not saying you must abstain completely, although there are situations in which I recommend complete abstinence as well, and we can talk about that in a little bit. But what we are saying essentially is that the effects are so much stronger that you have to be really very, very careful. Plus, drinking too much alcohol after bariatric surgery defeats the purpose of bariatric surgery because it may slow down weight loss, or it may even lead to gaining weight afterwards. But there are other issues also that are very important, Kemal, and that is a person can find themselves becoming addicted to alcohol much more quickly after bariatric surgery than before, particularly if they struggled, if they were on the borderline of becoming really dependent on alcohol before surgery. It is very important that they think think hard before they start drinking alcohol, because it's very easy to substitute something like food, which you love to eat frequently, right, before bariatric surgery, with alcohol. That can happen much more easily. In fact, we know that up to 3, 4, 5% of bariatric patients can end up having dependency of alcohol afterwards, just because there is that substitution of one eating to feel comfortable, to feel less stressed, with alcohol afterwards, which can be a very dangerous situation, essentially. Now, if a person becomes alcoholic, particularly after gastric bypass, it's very dangerous because they can end up in liver failure much, much more quickly than they would otherwise do if they didn't have surgery.
And just kind of like, maybe I'm asking these questions out of order, but we have a lot of restrictions for the smoking side of it, but on the drinking, right before the surgery, what's our policy, like 1 month before or 2 months before of the bariatric surgery for drinking?
For drinking, I would say probably 2 weeks is enough, Kemal. We're talking about people who are just drinking occasionally or just socially, right? Because remember, for about 2 weeks, sometimes 3 weeks, we put our patients on a special diet, the New Direction robot diet that we use to shrink the size of the liver. That is a fairly calorie restricted diet that we don't want people to be drinking alcohol in that situation, obviously, because they're not going to be eating.
The restriction is more about, or the change in adjustments. Let's call it adjustment. The restriction sounds kind of like negative, but the adjustment is more about, well, the preparation should be in our head, but it really is after the surgery that is going to be limiting us in a way that the stomach is going to be different. So then you won't be able to physically handle some of those anyway.
Absolutely.
And now you lost 100 pounds and you are not BMI 52, you are now BMI 29. Well, you can have your cake and eat it too.
Absolutely.
Right? So I think I'm clear on the alcohol issue, so that before we should really get ready. If we have issues, then we should look for counseling anyway.
Absolutely.
And after that, we are giving enough education where they need to really stop. And then otherwise, they will be in a lot of difficulty physically. But the smoking is different.
Absolutely. Before I go to smoking, Kemal, if I could just mention what would be our recommendations then for people clearly, right? I did mention what you could do in that social situation, right? So abstention, if possible, is actually a best policy, particularly for people who are at risk of becoming alcohol dependent afterwards. That's very important. Now, if I were to really recommend a particular alcoholic drink, I would say red wine is probably the best. Again, in moderation. This is very important to understand. We're talking about small amounts occasionally. Beer, we don't recommend because of the carbonation and also the high carbohydrate. Mixed drinks, particularly the ones that have, juices and sodas with lots of calories, obviously we wouldn't recommend. And of course, very hard spirits, we would not recommend either. So those would be the recommendations for after bariatric surgery. And as I say, generally, I say to people to really stay off alcohol for several months before they start introducing it again.
All right. Now, the smoking is a different issue because smoking has a adjustment requirements prior to the surgery, because our patients may be exposed to some danger if they don't stop smoking. So let's give some educations on that. Why is it matter to stop smoking way before the surgery?
Absolutely. So smoking has direct impact on the rate of complications after surgery, right? This is really for any type of surgery, but also we're talking about bariatric surgery here. So what can happen if a person is a smoker and they undergo surgery? Well, there could be problems leading to poor healing. So the rate of infection could go up, the rate of sepsis could go up. There would be problems with their respiratory system. So they are at higher risk to develop pneumonias, for instance. Mm-hmm. For instance, patients who are smokers and undergo general anesthesia, there is a high chance for them not being able to get off the breathing tube that they receive at the time of the surgery, so that they will have prolonged intubation, right? Sometimes these patients may be able to get rid of the breathing tube, but they may have a high chance of re-intubation, becoming dependent again on a breathing tube. So they may spend more days in the intensive care unit. So really, there are some serious implications in terms of complications of surgery for a person who is currently smoker and then undergoes surgery. So clearly, we have a zero tolerance policy in our bariatric surgery program, because it is dangerous for patients to be smokers and then undergo bariatric surgery. So we say people have to stop smoking. Having said that, Kemal, we also understand that tobacco is an exceedingly addictive substance. There is no question about that. So stopping smoking is one of the very hardest things that people have to do. And in fact, when I have discussions with my patients, the ones that identify themselves as smokers, I tell them there is a lot of preparation that has to go before bariatric surgery. By far, your greatest challenge is going to be stopping smoking, right? It's not easy. Now, there are other things that worry patients about stopping smoking. For instance, they worry about the fact that they will gain weight if they stop smoking. And it's true. People who are smokers, and particularly the ones who are heavy smokers, are able actually to prevent weight gain, by the smoking, right? Well, we will accept some weight gain during the preparation, even if we have to go and convince the insurance company that the reasons of why that happened, if that is going to get rid of the smoking, because smoking is so much more dangerous that some weight gain during the process could be acceptable by us as a consequence of them stopping smoking. So there are clearly direct dangers to the safety of the surgery when a person is a smoker and they want to undergo bariatric surgery, right? Now, the good thing is that if they are able to quit, and they must, right, before surgery, that's another additional benefit to their health, of course, because smoking has all the other bad things that come with it that everybody knows, whether it's lung cancer, whether it's heart disease, heart attack, and strokes, and all those things, right? So we are able to start preventing those things, obviously, if the person stops smoking.
So the part that when we are going through our one of the things that I want to bring up that I didn't have the image of, let's say we have a former smoker, quit smoking 8 months ago.
Yep.
And then we have 2 case conferences every day. And then one of our nurses find out that that patient had 3 cigarettes like a month before the surgery. Sometimes we take harsh actions on those. And I feel like those, that's kind of like a punitive almost. And then our patient population is already going through some trouble to getting ready. And you know how much work they have to do to be almost qualified for the surgery. So, how do you balance that?
So that's a tough one. I would say that we need to maintain that zero tolerance, right? Because at issue here is the safety of the surgery, right? And very often, remember, Kemal, Smoking, in my view, is an all or nothing, right? And very often the reported rate may be minimizing the actual rate of smoking, particularly when it's happening, right? So we will be satisfied when we see complete abstention. I think that is an important policy for us to maintain. Moreover, as we will talk, there are other issues for post-bariatric surgery that are critically important. If a person is a smoker or resumes smoking after bariatric surgery, right? So smoking itself can damage the lining of the stomach that is healing after surgery, leading to problems, particularly after gastric bypass. After gastric bypass, it is extremely dangerous for a person to be a smoker. And why is that? Well, when we do gastric bypass, we make a small stomach, the one that is as small as an egg, like the pouch, and we connect that to the intestine. That's an artificial connection that we make surgically. That connection is known as the anastomosis. The stomach and the intestine are connected through that little connection. And that's through which the food would pass from the pouch into the intestine. Now, with smoking, there is an effect on the vasculature, the blood supply to that area is vulnerable to formation of an ulcer, which is like a little wound. And that person's life will be miserable with that ulcer. First of all, they will have pain every time they try to eat. Very uncomfortable. Secondly, ulcers are dangerous. They could be life-threatening. An ulcer can burst, leading to sepsis of the abdomen. And unless surgery is undertaken emergently, that person could die with the burst ulcer. Ulcers can bleed. Massive bleeding can occur sometimes that may be difficult to control, and a person could die with that. So there are real dangers. So if, in fact, in my view, a person is even remotely a potential for somebody who can return back to smoking because they've stopped and restarted or whatnot in their history, right? I would tell them it probably is better for them to have the gastric sleeve than the gastric bypass because the dangers with smoking and gastric bypass are so enormous. Now, of course, we are focusing specifically on the issues with regard to bariatric surgery, but obviously you and I know, and most people know by now that smoking is a dangerous thing for one's health, regardless, because of all the other effects, whether it's the cardiovascular consequences or problems like lung cancer.
Sure. And that's what I said in the beginning, so that this is already bad. Both smoking and alcohol are problematic for any patients. But it's just like, getting the patients ready. And then when we see any patients who are making a bad decision selection, and then because of that, we have to kind of drop them or take a break from the process. It's just sad to see them just being away from the surgery for another like 6 months or so. Now, what other issues that we may have related to smoking for the patients right after the bariatric surgery?
Sure. So essentially the issues that I talked about and I focused more are the ones after gastric bypass with relation to the ulcer, of course, right? But even with the gastric sleeve, there could be damage to the lining of the stomach that can lead to pain, it can lead to bleeding, it can lead to ulcers there as well, right? So even gastric sleeve is not totally immune from the ravages that smoking can cause. But the more important and the critical one, in my view, is the one with smoking. And I've had patients, unfortunately, who have resumed smoking and have ended up with ulcers that have made their lives so miserable, right? Because the quality of life is so tough with an ulcer. It hurts all the time. And that ulcer will not heal whilst the person is still smoking. An ulcer is like a gaping wound, right? Imagine a person who has had an injury on their skin and you've got the skin gone and you see the wound underneath, right? That's exactly what an ulcer is, right? And when you try to eat and stuff goes on that surface that is not protected, it hurts. It hurts.
So now, from the description, I'm feeling the pain.
Yeah, it's miserable. It's a person with an ulcer that does not heal after gastric bypass have a very miserable life. And not to mention the fact that they will have to go to the hospital several times. They will have to undertake endoscopy many times, but unless the smoking is stopped, the ulcer will not heal. And then eventually that ulcer, as I said, can have the serious consequences I mentioned, but it can lead also to scar tissue that makes that opening so tight, right? It's called a stricture, that that person may be unable to eat now. Every time they try to eat, they may be throwing up, right? And that may require surgery to fix it, right? Mm-hmm. And that surgery is going to be repeat surgery, which is obviously going to be much more complex and potentially much more dangerous than the original surgery, because when you're operating second and third time on that same area, the tissue doesn't heal quite as well as it does the first time surgery is undertaken. So to save all these issues, the best policy would be to stop smoking. Now, we live in the real world, and we know what the real world is, Kemal, right? We can counsel our patients, we can tell them, but it doesn't mean this doesn't happen. It does happen. Patients become smokers afterwards as well. But we have to try our best to counsel them. We have to try our best to really direct them towards their primary care doctors and others that can help them really fix this issue, because it just is not going to go away.
So the other thing that once we find out that they may be smoking, we ask our nurses to do the smoking cessation. What is smoking cessation?
So essentially what we do is, as soon as we identify somebody that is a smoker, that goes into the diagnosis, and one of the order that we put is smoking cessation, which means that our nurses, the bariatric coordinators, will follow up with that by providing materials and resources that will help that patient to quit smoking. And because obviously in our first encounter and our educational sessions, we really bring this issue, the seriousness of the issue so strongly, patients obviously understand that, and they also understand that their ability to go through the program and have surgery is at risk if they don't stop smoking. So, we follow it up with these recommendations, educational materials that will help them really realistically stop smoking. So by the way, Kemal, I have yet to meet a patient that has not been able to stop smoking before bariatric surgery. That's in 20 years. They've always been able to quit smoking, essentially because obviously they understand the importance of bariatric surgery. Now, have I had patients who have resumed smoking afterwards? Unfortunately, I have. That's why I was talking about the real world. But beforehand, it can happen. It can be done.
Well, I mean, I have some of from our old sessions, I have some of my notes handy. About 83% of diabetes, 82% of cardiovascular, 72 to 98% of reflux, 74 to 98% of the sleep apnea. These issues are going to be resolved. So, why would they not?
Absolutely, right? Absolutely.
This would be useful. So I was leaving it here. So then it is not you say it became useful. So,
absolutely.
Well, I mean, this is a life-changing event, Dr. Irgau. What we see every day. Every day. The other day I was joking that even Pope probably just prayed with the same frequency that we do a case conference. So every day we are doing a case conference. Now we do two. There are two teams,
right?
And because the discipline is there, the standard is there, and you mentioned zero tolerance, and I'm asking some of these questions to help the patients to understand the seriousness of the issue. This is not because we are trying to be difficult; it's because we are trying to protect them and also make it clear that we want them to have a good, pleasant experience. Because when you have the surgery, when you are going through these changes, yes, we want you to see the results, but we also want you to have that, from the time they have the surgery to the time to the resolution, that should be pleasant, shouldn't be painful. So, and the education is the main part of this. So, but it's an important change that they're going to go through.
Absolutely.
And we don't want anyone to lose the opportunity from what's available to them. So, How about the medical marijuana? Like, is that the same as the smoking?
So in terms of actually causing problems, particularly after gastric bypass, inhaled smoked marijuana actually can be as deleterious in terms of causing ulcers and causing irritation of that anastomosis. It is not. It has not been studied to the extent that we have been able to study, tobacco and nicotine. But we do know that patients who are particularly smoking marijuana, and particularly the ones who've had gastric bypass, it is an issue for them as well.
Okay. So, all right. Now, I think these are the main questions that I have. Do you want to add anything to the?
Yeah. So essentially, what is important for people to understand here is that what we do and the adjustments that you mentioned that we require are all geared to create a safe journey through bariatric surgery. That's important. So the safety is paramount, right? So when we are saying you must stop smoking a month before surgery, you must stop smoking 6 weeks before surgery, and then if you don't, we're not going to be able to proceed with the surgery, it shouldn't be seen as something punitive, right? We're not using that as a rite of passage. What we're saying is we want your surgery to be safe, right? That is something that we cannot negotiate with, right? The surgery has to be safe. And the reason we have extensive preparation before the surgery, unlike any other surgeries that patients have, right? We have extensive preparation, sending them to cardiology, undertaking tests, doing blood work, looking for problems that need to be fixed and adjusted before surgery. All this is to create an atmosphere of safety, right? And we owe it to our patients, right? They are undergoing electively a procedure, right? And we have to give them the maximum safety possible. And we are able to do that in programs like ours, so where we are a center of excellence under different criteria as Kemal at our surgery center. We are very proud of our safety profile. And the reason we have that safety profile is because we are able to educate and prepare our patients in such a manner.
No, absolutely. And, we are going to make sure that every Friday we are available so that we can provide more information. But I just want to remind again to our patients or potential prospect patients, Tuesdays, second and fourth Tuesday every month at 6 p.m., we do have a full webinar that's available if someone wants to watch the entire thing. As we are doing the topics one at a time, we do cover everything there, which is about 90 minutes or so. But we'll be back again next week with another topic. Dr. Irgau, thank you for being with us again, and I will see you guys next week. Thank you so much.